Pfizer and BioNTech striking an agreement with the U.S. government to supply an additional 100 million doses of their COVID-19 vaccine. Meg Terrell joins us now with the details. Meg.
Hey, Morgan. Well, this is another 100 million doses. We should get 70 million of those doses by the end of June, the end of the second quarter next year. 30 million to be delivered by the end of July. This really doubles the number that we've got from Pfizer. They're paying the same amount for these 100 million that they did for the first, almost $2 billion. So this together with the 200 million already agreed upon with Moderna would be enough for 200 million Americans to be vaccinated by the middle of next year. Now, here is how the rollout has been going over the last couple weeks. They have allocated almost 11 million doses between Pfizer and Moderna together. We are expecting an update today from Operation Warp Speed this afternoon, where we should learn what the allocations are for next week, how much will be going out. As for the pace of actually being able to administer these vaccinations, we are getting data from the CDC, but there is a couple days lag as of Monday morning, and so the numbers must be higher than this now. We just haven't seen from CDC yet. 4.6 million doses have gone out across the United States, 614,000 of those administered. But again, guys, these numbers must be higher as of today because this was 2 days ago. I'm hitting refresh on the CDC website to see what the new numbers are. But there will be many questions about how quickly can we get these doses out. 20 million are expected to be allocated, by the end of December, and that will go into the first week of January, actually getting those shots in arms. That will almost cover the entire top priority group in terms of vaccinations, healthcare workers and nursing home residents. And then we start to go into the next priority groups, guys. So this happening quickly. And in January, we're expecting J&J data as well, guys.
Yeah, we were crossing our fingers on the J&J part, that's for sure, Meg. As for that last mile, we're starting to get word now from the CVSs and the Walgreens of the world that they are going to need to hire more pharmacy techs, more healthcare workers to administer those vaccines to the general population. Are you getting any sense that there's going to be a bit of a labor crunch on that last mile?
Yeah, this is something we've kind of been hearing about as people have been preparing for this massive vaccination campaign. How do we just find enough people to administer these shots? And so, we have been hearing and our colleagues have been reporting about needing to find the folks to be able to do this, not just CVS and Walgreens, but, there's talk about employing everybody across the healthcare space to help give these shots. Dentists, ophthalmologists, really anybody who could be in a medical, role helping give these shots. Because we're talking about trying to vaccinate, 260 million Americans, the adults who are indicated for these vaccines. And that's a lot of people, especially if we're trying to get them done by the middle of next year.
Shepard Smith here. Thanks for watching CNBC on YouTube.